Welcome to Home Care, Doors Open, where we discuss licensing, operations, and scaling your home care business. Whether you're just opening your doors or looking to unlock new doors to growth and success, this podcast is for you. Let's begin.
Hello, everybody. This is Lucas Carroll from the Business of Senior Care. We are back with another great podcast episode on Home Care, Doors Open. Today, we have a very special guest. We have Denise Bellville, who is the Executive Director at the Home Care Association in Florida. Denise, welcome. Thank you very much for joining us today.
Thank you so much for the invitation, Lucas. I appreciate it.
Absolutely. I have so many things, so many exciting things that I want to talk to you about and get your expertise and feedback on, and along with the association. But before we go there, I just want to learn a little bit about, if you could share, how did you get into, what's your background and experience? How did you get into the home care space? And you've been in home care for a long time, have a lot of experience up to now. Could you share a little bit about that background?
You bet. In fact, my introduction into home care, I've been a nurse for 45 years, so a long time. So have that a wide background. But I was working in pediatrics in a open heart unit in our local children's hospital, and we had a child who needed to go home on a ventilator. They were having trouble staffing her, and asked, hey, can you take this kid home for a couple days? You'll be off. Can you just go take her home and get the family all set up? And 2 years later, I finally decided that I needed to not just do kids, but to expand my home care into doing some adults. And kind of had a mixture for a few years, and then moved really strictly on to adult home care, and have been doing home care since, and continued to work up the ladder from clinical, bedside care to doing operations for a large home care company in the state of Florida, and subsequently joined the board for the Home Care Association, and now I've stepped into that executive role.
Yes, absolutely. And you're a few months into the role. Congratulations on moving into the executive director role. That's very exciting.
It is exciting. Big steps.
Big step, absolutely.
Big steps.
For the association, can you share a little bit about who this association is, who they help to support, what kind of initiatives and things that the association focuses on?
You bet. We are a nonprofit trade organization in the state of Florida. So we operate under those requirements and rules and regulations. But we support a membership. So it is a member-driven organization. However, we really represent providers as a whole. Providers have issues and challenges as a unit. It may only be some of those who end up joining the trade association, and certainly we work for them. But our initiatives are related, one, to resources, two, for education for providers, and then also for advocacy as they might need even AHCA relationship. Perhaps it's a managed care organization relationship. They're not being paid, and they need some help related to that billing problem, or in this state, a lot of EVV challenges. And then, of course, anything that we can do through legislation that will help guide AHCA to giving the providers the best product, without too many hurdles to jump over. As you might know, Florida is highly regulated. Much more so than almost any of my comrades. The more I talk with other associations throughout the country, they say, really? You have to do what? So yeah, I often get those kinds of comments from folks who haven't arrived to an AHCA type of oversight. But at the same time, Home Care Association of Florida is a lead to other associations throughout the country. I was just at an executive meeting recently for 2 other states in the U.S. that are have a bill ready to go to their legislation regarding family home health aid care. And since our bill has already been passed and it's in AHCA regulation now for rule writing, they wanted to know, okay, bill's been passed. What have you already recognized should have been worded different, wish you had done? What are you going to plan to correct next year when it comes time for legislative session? So they were already partnering with Florida to see what they might be able to, get a better end product before it even goes to legislation. So Home Care Association is active with our providers, certified, non-certified, for private duty and palliative.
Perfect. I was just going to ask, what's the umbrella for the provider types? And so it's a wide range of home care type of entities. That you mentioned a little bit, which is interesting, just about being on the representing and having a voice for providers, and then having a relationship with AHCA. And I think that is so paramount, because it's such a regulated state when it comes to that approach to having that relationship. How do you, for AHCA and HCAF, what type of relationship is that, and how do you formulate that to be able to, for they're asking you for feedback, like when they pass for family home health aids? What is that like?
So, I have to tell you, of course, I'm short-lived in my role, but within that first 30 days, I had a visit with AHCA, and it was with Chief of Staff and Bureau Chief for Medicaid, several of those chiefs anyway, in that room. And although our time was meant to be for an hour, which was fine, we had some specific items that we were approaching them with. We were about 40 minutes into the conversation, and Stephen Grow, the Chief of Staff, says, "I know we're running out of time, but we have lots of questions for you." And it was myself and Kyle Simons, who's our Director of Governmental Affairs, and our lobbyist, Jimmy Card. Happy to answer those questions. And, half an hour later, we were still in conversation from their side, them asking, how are families responding to the family home health aid? Our agency's understanding that we changed some of the agency provider types. Have they been able to enroll correctly? Are they having any stumbling blocks related to that? So they were really inquiring. What we were hearing from our side and our providers felt like a great dialogue. In fact, there were a couple of edits. 2021, we had a bill passed that required all the home care agencies to complete direct worker data within your renewal process. And subsequently, it was supposed to be posted monthly, the results monthly, on AHCA's website. We haven't been able to locate it. We just thought maybe it was hidden someplace. We asked AHCA about those results. And, Chief of Staff Stephen says, we probably ought to run that data. And it wasn't specifically his responsibility, but it was AHCA's responsibility. And indeed, we were looking for that data. So just 2 weeks ago, we had our annual conference, and Kim Smoke, one of the AHCA chiefs, was at our conference. And the very first thing that she offered to the participants at the conference was data regarding the direct care worker. So she already had followed through with what the request was, and really gave some hints of what we feel like is so important to the providers as a whole. And truly, if we took that back to legislation, it might be easier for us to get a few of our initiatives through if they understood what that reality is coming from the providers, the shortage, and what we might be able to do to support the providers and essentially provide care. Our job is to meet the client and patient needs.
This episode is powered by the Business of Senior Care. The Business of Senior Care helps home care, home health, and hospice companies obtain their state home care license and accreditation through one-on-one consulting, fully customized policies, and years of expertise. To learn more, visit thebizofseniorcare.com. And now, back to our episode.
It's that's so wonderful to hear you talk about when you're having conversations with the organization like AHCA, that if you both see the end goal of providing care and how can we get there and what do we need to do, and they're both have different maybe perspectives or different feedback, but if you're having communication and open dialogue and you have an end goal of improving patient care or making access to care, I think that makes a big difference.
A big difference. And in fact, while we were at our conference here just a few weeks ago, had dinner with Kim Smoke and Susan Lowry, two of the folks from AHCA. And they were really engaged in talking about some of AHCA's initiatives, hospital at home, and those 25 hospitals in the state that have determined they want to be a part of that. And they really wanted to hear if we had any agencies who were involved and what that looked like. And I have to tell you, it was refreshing to hear that AHCA had an initiative that they really wanted to see how it was working for providers and what that looked like. And so now I have a hospital at home visit scheduled with a provider over on the East Coast because I haven't had an opportunity to see what that looks like. And then I feel like I now am able to have that conversation with AHCA on a different level. I'm partnering with them on what they're interested in. And maybe that will continue to help grow that relationship. We have quarterly visits scheduled with them anyway. But I think those in between contacts really made a difference for relationship building.
Absolutely. I'm curious on the provider side. So for your membership, when you have these initiatives that come out, when you have this legislation that gets implemented, what are some of the challenges? Like, so if they see things coming down and there are new implementations and new regulations in that, how does that translate typically to the provider? Where are the good and the bad in terms of struggling or trying to get implemented these things so they can be in compliance and also still run an agency?
I do have to tell you that I think that is the weakness, because I think new providers and current providers are not enrolled in the AHCA alerts or the AHCA forum or the AHCA distribution of contact. So every time there is a change within the agency, or let's say they post a open hearing for the new family home health aid rule, that only those that had signed up for alerts receive that information. So they don't know that they could have been involved. And then subsequently, when that is finalized, they also won't be the ones who know what they need to do about it. And it's such a sad. I feel bad for the home care agencies because I feel like it's the same way. I just spent the last couple days here in Region 8 visiting providers. And one, they don't know who HCAP is, but they also didn't know who the Agency for Healthcare Administration. Oh, one of the providers, I had my name badge on that said HCAP. She still thought, are you from those big people in Tallahassee? I really had no, and it was a private pay provider. Scared to death that we were there that she was in trouble for some reason. But I think that communication piece is where I feel like it's the hardest, because then the provider gets caught. And when I say caught, means, they had their annual survey and all these things are brought up and they have egg. They don't know. They don't know what they don't know. And I think that's part for us, knowing our penetration in Florida is about 28% of all providers. So if we're barely hitting a quarter of them, and AHCA is saying they are also don't have penetration into all of the agencies, we fail. I mean, I feel like as a trade association, I'd love to have everybody because I feel like it is the way to communicate to the providers and help them to implement. Even on this last call that AHCA had related to the family home health aid, is Ann Dalton said that is not that we'll have to take that to another sector of the agency because that is about how you operationalize this particular rule. So in that instance, even that call did not give further direction to all of the participants. So who's going to do that? I mean, I say that I want to be the one, but if I'm only going to hit 28%, what about all of the rest of them?
Yeah, absolutely. Yeah, and it's kind of fragmented, I guess, in terms of getting, some folks do receive communication and others, agencies have no idea about changes and updates. Yeah. I think, go ahead.
And oftentimes don't even know that they can reach out. They see AHCA as just that person, but not somebody that you could also pick up the phone and ask a question to.
I was just going to ask that.
Gives you the license.
Yeah, I was just going to ask that. What do you feel like is a good approach for an agency that's like, gosh, I feel like I'm behind the ball. I know that there have been changes, and they want to become informed so that they can make sure that they operationalize it. What would be a good pathway for an agency?
I'd love them if they would just go log on to AHCA and log on to the updates. I mean, there's places they can enter their information, and I must tell you, I think it needs to be more than one person in your agency. Because if it is the owner who logs on to do that, and the owner is an absent owner, they're perhaps not involved in that day to day, it's just an email that they might just click through, versus the administrator and the clinical person, whoever that is, that has oversight, that all of that information is what they need to do to implement into their agency, into their day-to-day. They never receive the information because they have one contact.
Yeah, absolutely.
And I think that that's oftentimes, because I feel like it happens with us as the association, is the owner joins, doesn't add any other emails, so the member never gets to take advantage of the benefits because nobody knows about them.
Yeah, I like that. I like that suggestion about joining the alerts. And where our company and kind of HCAP typically interlock is that we try and support agency owners, home care owners with licensing and compliance. And one of the things in Florida that we often talk about with clients is make sure to get a committee together. So just like you're saying, it's not the owner of the company, but have the owner, the administrator, if there's a nursing supervisor, if it's a skilled agency, and then maybe one other member, and puts quarterly meetings on the calendar. And part of your quarterly meetings is updates and changes to regulation that affect your agency. And I think having that alert stream coming and going to everybody on that committee, and then having conversations like, hey, this family home health aid is coming down the pipe. This update has come down the pipe. Let's read it together as a team. And now let's talk about what are we going to do for our agency? How are we going to put that into practice? So trying to get those quarterly or routine meetings to take the fire hose of information that's coming and try and put it into operation for your agency.
And I have to tell you, Lucas, based on what you just said, I would have also included the HR component. I feel like HR becomes the last person, but should be the first person for all. I think about all the things that come down from AHCA, and especially thinking about this family home health aid. How involved should HR be? The right candidate, meaning is that family member the qualifying? Have they met the training? So if you think about all of that, then we have to operationalize that person into the business model. That whole thing, I think oftentimes too many of the regulations come out, HR doesn't know about them, and subsequently somebody says, oh, we're supposed to do that with our employees, or we need to, whatever that situation is, but happens too often.
Absolutely. Um, One question I was wanted to ask you is about the current focus for the association. As you look for 24 into 25, are there some big topics in addition to the ones that you've already talked about that are on the agenda that you want to be sure they engage in, that you want your membership to know, that you want other providers to know, that you're focusing on as you move into next year?
One of the things that came out of last legislative session was that they put money into a um, they put legislation put money into a group of I'm so sorry, it has
Yeah, no worries.
my mind just dropped on it was part of the contract that they wanted to do a summary. They wanted a group of data collectors to summarize what was the direct care worker shortage going to look like in the years ahead, so that they could begin to create the right legislation to help match that. Part of that was even for the Home Care Association for last year, is that we wanted to look at having the agencies be able to have a contract nurse complete a start of care. In the state of Florida, you can't. They have to be a W-2 employee. And therefore, we can't use a contract nurse to do that. The hospitals certainly use contract nurses a lot during COVID, and subsequently even the Association for the Hospital Association with Mary Mayhew, they did a whole study on what that looks like up through 2035, and to recognize the number of individuals 65 and older that will be accessing care versus the number of eligible care workers that are going to come into the age of service. We're still going to continue to have that discrepancy, and in this state, the desire for an RN is every agency we talk to. It's not just that they need a home health aide, but they need nurses. And so one of our motions, our motive for during this next session is going to be back around contract nursing and that opportunity to be able to meet that need prior to a bigger problem. And part of that came out of even the proposed final rule for 2025 for the certified folks, is the obligation to have to post your availability of being able to care for a patient based on all of your skill sets that you have available. You might have enough to take care of your Medicare patients, but your MCO patients are going to be put off for a week because that's the next time your nurse has availability.
Yeah.
That patient, however, has already been rehospitalized in the first 7 days before you even got to them. And what that cost to the system what that cost has looked like. So that is really one of our pushes. We are utilizing some of the resources that we already have, as I said, through the Hospital Association, and this last data collection that the legislation asked for. So let's see what we can do to help meet the client needs, those patient needs. Let's get them admitted in the 48 hours that we want, and see what we can do to continue to improve that.
That's great.
One other thing that we are really going back to legislation for is going to be a little clarity related to some standardization to the contract agreements for the recently selected MCOs for the Medicaid population, because all of them have a component of a value-based component, but it's unknown to the providers. And in that instance, a provider who signs an agreement that just says value-based doesn't have any insight as to what they might need to change today to effectively meet whatever that value based is going to be in the future. And could we have improved on that in the ITN, perhaps, with those MCOs from the beginning to make sure that we are helping our providers with their end product. So we'd really like to go back and see what we can do about improving that standardization so the providers have a better outcome.
Well, those are two very awesome things to hear. And more information about the value-based piece. And then I know that we have clients that'll jump for joy about the potential for contract nursing. Just as we help agencies, skilled and non-skilled, to go through licensure, one of the biggest components is finding the registered nurse to be on their team and finding, it's hard. It's hard not only in our space, in the hospital space. I mean, everywhere it's hard to find registered nurses, and that's providing a little bit more flexibility to be able to still, operate your agency with that contract that's great to hear. So hopefully there'll be more on that.
We're hoping. But if you get the right people to partner with, then that will help. For instance, I'm going to a baseball game tonight with a local senator and our lobbyist to hopefully get a little chat in about some of those initiatives moving forward. So you take whatever opportunity you can to meet with the right folks and fill their heart with some desire to follow what's in your heart.
Absolutely. Very well said. The last thing I was kind of thinking, just to kind of close this out on a positive note, looking at from a provider perspective, what are your thoughts on, what the demand for this type of space and continues to grow for home care. If you're a provider in Florida or you're looking to be, and what do you think the future looks like for our types of providers and the success of these businesses as we move forward?
Diversification. I feel like it is very difficult with the margins that you have and the cost of doing business that if you don't offer more than one product line, I think your sustainability through the future you're losing an opportunity. I truly feel like that. I feel like the number of people moving into our state and then the aging of the state, even if your niche is pediatrics, is there something else? Is there something else that you feel like within your skill set of your organization that you could offer? Or some of our certified providers, could they also offer a palliative opportunity? So they're expanding their horizon. There's nurses out there who have experience who could help you to grow that. I think if you don't diversify, I think sustainability is a lot harder.
Yeah. Not having all of your eggs in one payer source or one type of patient that you're providing care for makes you a more well-rounded and a less risky business for sure. Well, good. Well, very good, Denise. I can't thank you enough for taking the time and talking about sharing your wisdom and expertise, and especially as you come into your new role. And so I want to wish you the best success as you move into your new role, and thank you again for taking the time on our podcast to share.
Oh, I appreciate it so much. I think our chosen field is to really help those who are at home and in that home environment. And there isn't one individual who is ill who wouldn't say, I want to be home. And if we're able to meet that lifespan at home, I think we've provided a service that, in this industry, that should be our life motto every day, to make a difference in somebody's life. If we can do that at home, we're going to do that.
Very well said. Overwhelming majority of people just want to stay home and stay safe in their own home rather than going somewhere else.
If you found this conversation valuable, please leave a review on your favorite podcast platform. Also, be sure to like, comment, and subscribe to our YouTube channel, The Business of Senior Care. We'll see you next time on Home Care. Doors open.